first result was looking at that labeled phenylalanine result. So here, as I said, you give the stable isotope labeled phenylalanine, and then watch its metabolism into in the blood. The characteristic compound that can be identified is called tranexamic acid, or TCA, and in the urine you pick it up as a different chemical called hippuric acid. So in the first of those studies, looking at first just looking at the level of phenylalanine in the blood, what was seen was that the level of the D5, the labeled phenylalanine in the blood, was lower after administration of the probiotic, the Synlogic medication, than it was when it was taken without it. That was about a 40% decrease. So this is an important result, because it indicated that the medication was in fact reducing the amount of phenylalanine that was being taken up by the intestine. The next step in that was then to actually look at the total phenylalanine in patients' blood, because ultimately what you want to be able to do is show that you can reduce that in patients with PKU. So this was there were 9 patients originally in the study. One discontinued it because for reasons unrelated to the study. After 14 days of treatment with the medication, there was a reduction in the phenylalanine from the baseline level of about 20%. The interesting thing was that when patients were then taken off the drug and their phenylalanine levels were measured, they were actually 20% higher than they were at baseline. And so it's actually possible that the real effect here is a little bit higher. It's actually a fairly common phenomenon. You know, when you come in, you know you're going to be tested, you behave yourself, and so folks have a tendency to come in with a little bit lower fee when they walk in the doctor's office than when they test themselves at home. But at the very least, we do know that it was shown that the patients had overall a 20% reduction in their fee. Now, the result was uneven, and so. Just that there were some patients who seemed to respond more than others, and taking the ones who responded well to the drug and turning that percent into an actual phenylalanine reduction at day 14, the individuals who responded had dropped their phenylalanine level by 250 micromolar, and the corresponding increase when they came off the drug was 187 micromolar. So somewhere on the order of about a 400 micromolar difference there. And just to put that in context, normal Phe level in the blood is between 60 and 120. And these patients, when they are untreated, have a tendency to be around 1200 or 1400. So just to put that in the perspective. The drug was very well tolerated. The biggest issues reported were related to GI upset. So it's if you're taking a load of bacteria, and some individuals do respond to that, and there are some tricks that can be used to reduce that the GI. Some just had some cramping, some had some gassiness. Occasionally, a report of an occasional bout of diarrhea. So some improvements needed in the delivery, but that all seems to be likely to be sorted out with future preparations. In summary, these individuals had a 40% reduction in the absorbance of their labeled phe when they were given that as a load. The metabolites of the hippuric acid and the tranexamic acid were readily identifiable after that load, so it was clear that they were being metabolized as well. There was a 20% reduction in the fasting phe and a 250 micromolar reduction in the responders. It looks like it's a medication that's moving in the right direction. I mentioned early on that this was a first generation drug. The company's actually has a second generation drug that they presented in a separate presentation, a poster presentation at this meeting, that increases the number of copies of the various enzymes and transporters that are working in this first generation, and based on that poster, which I was not an author on, so I went and took a look at it a little bit earlier today because I actually haven't even seen it. But it looks like that drug, that second generation drug, may have about double the phenylalanine metabolizing capacity of the first generation drug. So the next iteration of this trial will use that more potent version of their probiotic to moving forward.